Everybody, Jonathan Nez here. Another town hall meeting. We are live coming to you from your Navajo Nation capital, Window Rock, Arizona. And we welcome you here. We have many individuals tuning in this morning. Uh, Maybell, we have Brenda, Margie, and many others that are tuning in from the Navajo Nation and all around the country and all over the world with our World Wide Web access. Thank you for joining us, Tammy. Good morning. And we do this every week, and every Tuesdays we come to you live because transparency and information is important to share with our constituents. Information is power, and the days of things happening in the shadows of Window Rock is no more. We are sharing information to you on a consistent basis. This should be how government operates. And a lot of information in our social media pages, from what's happening in government to what's happening in hardship assistance with COVID-19. Just visit our social media pages from Facebook to Instagram, Twitter, even TikTok. And so we ask that you check those pages out, and we'll give you a lot of information. Daryl Yazzie, good morning. Thank you for joining us, and many others throughout the Navajo Nation. So we'll get right into it. Ya tesh kero shna kwa dan hinal gido da isnal tsagi jodi kwan bindel kidigido hanen hi jikondel ingi ein hincha the nanoslini jo hot out ein hi Washington has argent hilbeda has no e hot out njonado jo eshin hot out e yadi internet dat egido bindel kidigi kat dahallo ebony na ek chudel en kojen hi Washington has age ebony na ek at atahon neligini Washington has age en hilbeda has الكلاشي دو أخت دنده يا إيش باندا الدي تسلا هو زند شينكوين زند كري أشون دي تا هندو نهات أدو نانتين هيجي كونديل so here la إزي با ayat ben ado Elaine do ado laiko hada so kies ado here dan tabidi nido le kun khandal nashiya hi Washington has age it's is bahaya do it's is banahat inigi age has age Department of Health Dr. Jill Jim should sue a age large atsiladain lido ot abananish illa kana di nacha so ba hnitzen aro kje Washington has age do it's is ba hayaje and das neligido hi Washington has age Rosalind Sodo Captain Brian Johnson hot out ka nature hot Kade beach ini ka na hadlendi de kosinskagina has states at da kon hadainolne aro ke koje stoit ini do naltsos kadal inigia epidemiology department judeliazi edo ke kodon khat shine e yan del khato naltsos kade le eot ai ni chashchana endeli kuich ala jindat leo hot ahnen yiji kondeli so here na da isnot stagido dan hinatigi. We want to first of all just let everybody know that there has been a lot of concern about the monkeypox that has been detected in Arizona, Maricopa County. This morning I got an update. No confirmed monkeypox cases here on the Navajo Nation. So let's wear our mask. Of course, any bug slows down or the prevention of these bugs being caught or being taken to the Navajo Nation, bringing into the Navajo Nation is pushed back by wearing masks, following these protocols. That same protocols for COVID-19 is the same protocols that pushes monkeypox, and even the flu, believe it or not. There's been a high rate of flu cases these past couple of months. I think because we're starting to, uh, you know, not follow these protocols. And we just continue to ask everyone. Even the government is starting to see our employees catching the virus and catching it again. And we just need to continue to follow these protocols. We test a lot in government. We have these test kits that are available. Some of them are available at your local chapter houses, your local healthcare facilities. These COVID-19 test kits, it comes with some solution, and of course, with the Q-tips you put in your nose. I know people say it's time to clean your nose, joking around, but we've been doing a lot of this. One of the things that I really ask of you, Navajo people, is if you take a home test and you are positive COVID-19, immediately go to your local healthcare facility. Please don't be embarrassed. Just do it. Isolate as well, right? And then, you know what? There's this initiative called Test to Treat. That means once you get positive, go to the healthcare facility. They have medicine that they can give you a pill or other medicines that can help you recover quickly. Of course, the COVID-19 vaccine helps push the virus away, but if you do catch it, it's important that you go to the healthcare facility. And that way we have an accurate count, right? To report every week to you all. It might be underreported because people catch the virus, they get positive case at these home tests and they don't share that information with government. And so it might be beginning to be underreported. But of course, you need to also isolate at home. And if someone catches the virus at home, you isolate them in the room. And I just encourage everybody in the household to wear their mask. We learned a lot from these past 2 years, and not to diminish the severity of COVID-19. We have to continue to follow these protocols. But what we're seeing also is not that many people ending up in the hospitals. That's great, that's good, but that doesn't mean you stop doing what you're doing. Get your boosters. Those of you that are 50 and over, get your boosters. Fourth boosters for fourth shot. I call them the fourth shot. You got first, second, right? The first, second time, and then the third. This is the fourth, now fourth shot. The kids are now available to get their third shot. So I encourage your children to get the third shot. And fourth shot is available to those that have some health issues or in the most vulnerable population category. So if you're in that category, get your booster. Just let your healthcare professional know you want the fourth shot. And so, again, monkeypox not here on the Navajo Nation. Let's keep it that way. Keep up the good work and helping each other out. We saw an uptick. If you can put the Eli, put the chart up on the screen there. It shows you the last 14 days COVID-19 case counts. That includes positive cases and also the deaths. Our thoughts and prayers go out to our Navajo people. And if you look at the blue line, you can see an increase in June all the way into mid-June. Fluctuation of ups and downs of the COVID cases. As you know, as we have reported, the states have slowed down their reporting. They're not every day like we do it. So that kind of throws off our numbers too, because we have to reconcile our numbers. Sometimes we have to put other days together and makes it look like there's a big jump in cases. But you also need to recognize too that this might not be an accurate count, and that's what we want to shoot for, is an accurate count, because people do test at home and become positive, but they don't report it to the healthcare facilities. But you see the progression, the ups and downs, and that just shows you that COVID-19 is here. It's still here, and keep the mask on, keep the protocols in place. If you look at the brown line, thoughts and prayers go out to our loved ones who went back to the Creator, and the families that are still here that are grieving. We pray for them. Very low numbers, but of course, one is one way too many. And let's continue to keep up the hard work in our communities and wearing masks. So you saw that during the Memorial Day weekend. You saw that for graduations. But you know what? When I was out there in graduations, everyone that was out there enjoying the graduations were wearing masks. Of course, as you know, when I speak, I take off my mask, or when the family requests that we take a picture, I take off my mask real quick, put it back on. And that's just a special time for our families to remember. But I thank you to every one of you for praying for us that we don't catch the virus. Prayers are important, and in return, we pray for the Navajo people. Vice President Lizer, First Lady Cecilia Naz, Second Lady Dottie Lizer, and our administration continue to hold you up in prayer. And so as we move forward into other events, July 4th is coming up. You got parades and fairs. Of course, those are still scheduled unless it goes increases in numbers. We have the protocols in place. Larry Ellis, thank you for joining us from Tuba City. And thank you everyone for tuning in to these important calls. We used to have a lot of people tuning in, but of course everybody's getting back to work, getting back to some normal. But I asked you all to share this information. Ben dat nog tien. Kodohan net niet je kon deel ingi. Zel en dan linigi Dr. Jill Jim at Siladane linigi. Captain Johnson Del Yazi ju kodo ein dan tien. Han net niet je kon deel in. Adon niet je kon deel ingi een hik an hasala. Ben dat nog tien. Lego tada do kaho. Ashonishik een of leni. Nakailchin bije yadaltje. Ni edan lenigi. Hadainoslne kane bichini ka yego dat. Hadainoslne dadi no bichidi hoda. Aron lede do ode bilgana do alskodo de nedan lenigi danichinal. Njonego da ilala de nedan lenigin lede. Ebenina edo yego ekoniki keni hinne. Bedat de net dat die kosenskagen hast iets at da no nchada hanni shkeno slini hada inosle. And in conclusion, I appreciate the IHS Rosalind So. As you know, she's going to be going up for a vote to the U.S. Senate to be our director for the entire Indian Health Services, and that's 12 areas. She represented one area of the 12, that's the Navajo area. And she done an outstanding job working with the Navajo Nation, not going above us, right alongside us with Dr. Jill Jim and other 638 facilities, and our partners like John Hopkins. I surrounded, as your president, I surrounded myself with these professionals, and that's how these protocols were put in place, with their guidance and with their help. And I appreciate the hard work that each and every one have done. Dr. Jill, Jim, Brian, Captain Johnson, Rosin, so good luck. And if you know some senators, send in a support email to the U.S. Senate for support of her confirmation as well. And we look forward to her being our IHS director. She is fully qualified, and she knows what's happening in Indian country. Lastly, get your shots, get your boosters, continue to follow the protocols in place, and don't just listen to the leadership here. Uh, Continue to watch because Dr. Jill Jim has some very important messages, Captain Johnson as well. And please stay for Deliazi presentation. Very thorough, tells you what's going on, communities that have high transmission rates. That way we're informed and we share that with our people. So thank you so much. And I'll before I transition, I'll do a quick prayer and I'll turn the time over to Dr. Jill Jim. Our Heavenly Father, we just come to you this day. Here la kung inan khain la gish di ni ot e ara kwa sa si klingi do ara ni keni hinna da nasligi ton lo do da sa shwan shi di ni ot e ara kon ni keni hinna sa shi bjen da has ti do bje da stil benet da stil sa shi e kon na ol de e do kon an di de kregi do kon an hina nish an di dahlo kon den hije shi a shane di lito kon do di naslegi don hitsa kon sin shi di yot e do kon zel in dan lingi do tsla da al so kon nkhanda pa do nkhanda lishi do beton lo do nes bike dan lingi do e di naslegi do tsa kon sin shi di yot e. We just pray, Lord, that you just continue to keep the COVID-19 away from our people, our first responders. They're out there on a daily basis, from police officers to corrections officers to healthcare professionals. Gosh, there's just so many people helping our Navajo people. We just ask for protection. We ask for wisdom. We ask for good health. And we ask for strength for all of them and all our Navajo people as well to continue to spread the message of precaution. And we just ask that this be a testimony for you, that people will know that you are in control of it, and our prayers are the one that has been pushing this COVID-19 away with you at the forefront. And we just thank you again, and we pray this all in the name of Jesus Christ. Amen. And we'll turn it over to Dr. Jill Jim, Department of Health, Division Director, Executive Director. Take it away, Dr. Jim.
Thank you, President Hietnon, for making all those comments regarding just the precaution about other diseases that we're dealing with here on the Navajo Nation. It's just not the pandemic. So, Dr. Jill Jimin Shadow, done and the look on the song touching but just change or exchange as a dog. Zatlana doesn't know I don't know this on the ice in the shadow. It's is behind it big adens ain't dog. Ocean quite hit not on it in the digi acre or here in the door. Backet on the gen shade of the cladding in the cheese organization at the doors ocean at doors ocean cladding. Nitsa waneta to the nindi the cushion charginas it's at the holiganigi at the co on at nito at the saho on the isin no ayo doors or bells and the not let the shin to the hit other the she it mutates into different variants of the belagana at the what are holia and so DC is it in the nido researchers that and gishi at the day kan the dozo I dozo behosenda do kaya ha iki do di do shi an can sick has do shi mental health and that the ninigi hate di in not do kaya di but on that shi do di long COVID do ati that the nedo by a deal do do jo shi 1,000 do ati deal ka do ishi ben not kaya di Nasco do behozennigi shidi di hashit adi laha oning ligi ati big at di tido ati del kato do jo behozenda ishin no kwadi an hil behozennigi shin e kwadi an hi chingdon his big estri o de nilsen don hilat hande gisto ist at nilsen do et anja and da si jo ya del do a ilkene kahandishin a kwa ba da nilsen do adolshin kwadi kushin ngalchinen da do at the adolshin latin da iltrat and the shin oshin kwadi COVID-19 safe practices that the need the 3 Ws e kwa ba behan dates ishin kwa at the and do big at the hot oshin kwadi ayahat edo ado the public health orders that the ninigi do La'ana de neta binatigi kwadin nihazet and the nishido a kwadi do are you dedicated to a hospitalizations that the nika a I use it dedicated go a kwadi so that the nido kwadi by a deal kit that do the nihazet and I don't see it as kido do are you that do kwa is it in the nido do are you hold on the ishin binatja hot quite big at that neat in quite head the trending Haliani that the Nisha a quite the health command operations team when Yanigi Del Patina ya had the a quite on you get a days in don't they call it all creature Adoshi a na what it's iso had this to I don't that initiate that a quite in quite between the nishigi a quite Indian Health Service don hinat ani do quite 638 dot any do quite John Hopkins dot any quite a he go on the hate ado Nasco eshi quite Navajo quite he kaya hagi hate di quite the question sagi nas at nastate ada quite nas quite heit adi ati ishin deilnis todo heit adi and the heit ado jodi ka adi do ai sinnet honeta ibn net shin ka en hat ade jodi COVID testing that the ne ka testing programs and options ka home testing kits do all on the ado the home support that yenigi ka adi that the hospital does not go a quality we issue out food boxes a do best of it still requires coordination adon dot kagi they still have to work on other things like genomic sequencing that any a at the is uncanon shot a biatasil keton the height naso Oshin with angel thousand or what up at this do Oshin ihe non hitini do kwadi ni chinton his a big est o dinosan ashwanda ashisini digne can go kitwa hot the shah was inkle and he did not you kwadi but the chinto bezet big est net ardenly Quanta Gallup or Albuquerque or Nle Kitanda da Javaho and hit the Nepachinto Bezek big at the Ashkina. Ade Ani Ayo Aya Hatchan Highland Jo Altropic at the Hanil Ida that Hola and a quality what I Yilchan Adoshi as a reminder I'll say Belagana get that just to keep your mask on when you're out in the community, even though it's not required. It's still a protection from you to get sick. And so we just want to remind everyone to practice all the 3 Ws. And that's what I wanted just to remind everyone and share that information. So I know President mentioned the monkeypox and it hasn't been detected on the nation and that is basically monkeypox is a rare disease caused by the infection of a monkeypox virus. It was first discovered in 1958 with the first human case recorded in 1970 in the Democratic Republic of Congo. Since then, cases have been reported in several Central and Western African countries, and some symptoms that could be similar, but not really. Fever, headache, swollen lymph nodes, and rash. And it has different incubation periods as well. So just as a reminder, anytime you see sort of something wrong with your body, of course, we always encourage people to get sick, and it can be transmitted in various ways. Occurs when a person comes in contact with the virus from an animal, human, or materials contaminated with the virus. So as prevention, same thing applies. Avoid close contact with infected persons or contaminated materials. Isolate infected patients from others, and also practice good hygiene, washing hands, soap and water, or alcohol-based hand sanitizer. So those are all the precautions that we talked about with COVID, with any infectious disease, and also foodborne illnesses too, such as salmonella and other concerns that we have here on the Navajo Nation, just for everyone to stay safe. And those are some of the reasons that we remind everyone. So I just wanted to say, I'll hand it over to Captain Johnson. He's with the Navajo area IHS, and I'm looking forward to hearing to what you're going to say, Captain Johnson. So I'll hand it over to you now.
Thank you, Dr. Jim. I appreciate that. Yes, this is Captain Brian Johnson. I serve as the Acting Deputy Area Director for Navajo Area Indian Health Service. I work out of the area office in St. Michael's, Arizona. I just want to say hello to everyone out there across Navajo country. It's nice to be here with you again. Just a few comments on COVID-19. We, as Dr. Jim and President Nez mentioned, we continue. It's just, again, continues to be certainly a change in all of our lives with the arrival of COVID-19 in the United States, and more specifically here in the Navajo region. And but one thing we know is that we'll be continuing to deal with COVID-19 for likely for years to come. We always talk about the new normal, and it's something now that's in our environment, and we'll continue to have to make sure that we're following the guidelines, that we are making sure we're aware of what's in our environments around us, and through news outlets, through Facebook sessions such as this, and just to make sure that we're doing everything we can to keep our families well. So with Indian Health Service, we continue our work as well with Dr. Jim and her staff and President Nez and others to make sure that we continue to do public health measures to make sure we're properly addressing COVID. We continue to see cases, as was mentioned here. We know that we enjoyed a number of low case counts for a number of days and possibly a couple of months there, and we have seen some fluctuations over time. And the most recent example would be with the Memorial Day weekend. And just right after that weekend, we did see some increasing cases. And oftentimes we'll call those upticks or bumps in cases. And so we know that when we gather to celebrate, it just another point that we need to be extremely cautious, because if we let our guard down too much, then certainly we can see those cases increase. So again, I just want to make sure that folks understand that I know it's been a long road, a long journey, and we've seen some improvements over time. The improvements, many of those coming about because of the vaccinations that we have available to us. If we think about the the pandemic and we look back in time when we started and there were no vaccines whatsoever. But we were certainly spreading information about how to prevent COVID without the presence of a vaccine at that point in time. But over time, we know that the safety of those vaccines were studied. We know that a very cautious approach, while also making it an urgent approach because there were so many infections happening across the United States and the world for that matter. And so various risk groups were provided the vaccine over time in various age groups. And now we're basically down to a level where we say anyone 5 years old and older can get a vaccine, a COVID vaccine, and can also get booster doses as well, which makes it much easier to understand the age groups that have vaccines available. So again, that's anyone 5 years old and older are able to get a COVID vaccine and booster doses when appropriate. We still continue to encourage folks. We encourage families. You know, I made sure that my family all got vaccinated when those became available to them, and I certainly do encourage this for others as well. So just wanted to make sure that folks know that as we've moved, this has been a long timeline with this particular COVID event. And I think sometimes we get away from the mainstream conversation on it and we start forgetting where are we with this particular illness, and we start hearing about cases again. And so I think it's important, again, for the public to be knowledgeable that individuals 5 years old and older can certainly have the COVID vaccine and boosters. And we continue to recommend that you visit your local provider that you normally work with to make sure you're getting the information and the services you need. Now, again, some folks may be thinking, again, this has been a long event, this long pandemic, and some may say, well, it's been a while, I haven't really heard, or I've forgotten what the symptoms are. And those can range from fever and chills to having a cough, shortness of breath or difficulty breathing. You might feel fatigued or just very tired most of the day. You could experience muscle and body aches. Headaches is something that a number of patients have recorded and mentioned. And of course, we've all heard about the loss of taste or smell. And a sore throat oftentimes is something that leads into a positive result as well for COVID. And then what we're seeing even more recently is allergy type responses where individuals feel that they are basically having an allergic reaction to something because their nose is constantly running. And then they find out through doing a home test, or they go into the clinic and find out they're actually positive. So other symptoms are nausea and vomiting and diarrhea. But again, more recently, we're seeing a lot of patients who are exhibiting allergy type responses to the current variant that we're seeing here in Navajo. So very important. It's also important to understand that there's no need to panic if you do get a positive reading for COVID. We know that the currently what we're seeing is a milder response to the virus as opposed to seeing hospitalization. So our hospitalization rates have stayed down as a result of COVID, which is really good news. But we shouldn't just let that be the driving factor if we choose to do prevention activities or not. We still highly recommend that folks follow the various prevention tactics that Dr. Jim spoke about. Because one thing we do know is we do know the COVID virus mutates, meaning it changes its form. And when it changes its form, it changes how that reacts with each unique individual, which can become severe at times. And so it's important that we still do everything we can to prevent transmission of COVID to protect ourselves against getting infected with COVID. Still important to do those. I also wanted to reiterate that you know, nothing has changed in terms of testing. We know that we have home testing that can be done, and those test kits are available from the various health facilities. But we also know that the health facilities continue to do the testing as well. I want people to know that those services continue to be very active. And if you feel that you would like to get tested at the health facility, again, I recommend reaching out to the normal facility that you seek services from, and they can certainly help that with you. In terms of vaccinations, similar to the testing, we continue to really encourage the public. If you haven't been vaccinated at this point in time, there's no need to feel bad or embarrassed or as if you can't get a vaccine at this point in time, because you can. The vaccines remain available. We continue to keep those in plenty of stock, so that anytime patients need either the initial doses of vaccine, or if they need one of the booster shots, that we're certainly have maintaining those supplies on hand. So certainly, if you've had a change of heart, maybe you held off getting vaccinated, now's just as good a time as any to make sure that you get your vaccination. That has not changed. We continue to encourage folks to do that. We've done a great job here on Navajo Nation. We know our numbers are as good as anywhere in the world, and that speaks highly to the Navajo people, and really doing what we can to make sure we're getting vaccinated and to protect our families, our friends, our loved ones here on Navajo. So again, just very important. We continue to wear masks. You'll see those, and again, off-site, maybe in cities, including Gallup or Albuquerque, or I'm originally from the state of Oklahoma, and I went home to visit a while back, and nobody was wearing a mask, and the transmission rate of COVID was really blowing up. It was really increasing rapidly. And so it still remains important. If you have the opportunity to wear your mask in public, certainly suggests that you continue to do that. But also just making sure, some of those basic things, and I think Dr. Jim touched on it very eloquently with her comments, is that, washing hands continues to be such an important public health measure. Um, you know, Between washing your hands and wearing masks, you can prevent much of the COVID transmission that happens in our environment. But the most important thing you can do is still get those vaccines, get those vaccinations taken care of for everyone 5 years old and older. I just wanted to transition just for a moment, and I know that President Nez touched on it, as well as Dr. Jim, in terms of monkeypox, and wanted to reiterate that we have not had a reported case here on Navajo at this point in time. We know that it's been fairly rare thus far in the United States in general, but some folks may say, "Well, I've heard of monkeypox," or this is the first time I'm hearing about monkeypox. And while I won't go into great detail, just for time's sake here, what I will mention is that this is certainly it's not a new disease. This is something that public health officials have been aware of worldwide for many years. And we do have the tools that are needed to be able to tackle this, or to prevent further transmission. So that's important to know. Um, Monkeypox is not very similar to COVID-19. It's a virus that does not mutate or change quickly. Now, when we talk about COVID and the COVID virus, we know that we talked about mutations and how that virus changes. But with monkeypox, it's something that is more stable and does not mutate or change quickly. When we talk about who is at risk, and really the people who are at risk for monkeypox are those who have been in close contact with someone who was infected with that particular disease. So monkeypox actually spreads through close uh, contact, sustained skin contact with someone who has an active rash, or who from their breathing in small droplets when close to an infected person. So, the difference being here is that skin-to-skin contact is the predominant means of transmission of monkeypox. There is some potential for transmission through breathing in droplets from an infected individual. However, it's not as transmissible or as infectious as what we see with COVID from the respiratory side. So just making sure that folks under that. We know that so far the cases that have been seen have not been severe in nature. The majority of infected individuals experience flu-like symptoms and a rash, and which, while the rash is painful, it resolves in 2 to 4 weeks. So that's what we're talking about. And just also that the United States has certainly prepared by investing in tests, medicines, and vaccines needed to respond to any outbreak of monkeypox. So at this point, it's been really controlled nationally in the United States. But I think it's important for the public to generally know that there are vaccines available, there are treatments available for monkeypox, should we start seeing cases here on Navajo. And again, I want to state, we have not seen, or there's been no report of a monkeypox case here on the Navajo Nation. So very important to make sure we're communicating that clearly. So there is somewhat of an expectation among public health officials that since we have seen some cases in the United States, the closest one being in the state of Arizona, we do expect that there will be more cases that will come up. Will we see outbreaks of monkeypox? It's hard to say, but what we do know is we're in a different situation when it comes to monkeypox, in that we do have the vaccines that are available. We do have treatments that are available, whereas with COVID-19, of course, those had to go into a developmental stage, had to be created, and had to be tested. So just wanted to share those key points. I think that's probably enough for today on monkeypox. So, and if you have any questions, feel free again to reach out to your local provider. There's plenty of information online, but I do recommend, if you, as always, as we've talked about over a series of years now, if you're looking online for information, please make sure you're using a reputable healthcare site or public health site, such as the CDC. There's other sites such as Johns Hopkins and other universities, but there's also a tremendous amount of misinformation on the internet that oftentimes puts fear in folks and uses scare tactics, and that's not what we're about. We're about sharing accurate information that helps people understand what risk they're at. I would say right now with monkeypox, the risk is extremely low, but we all need to be aware of some of the basics, and I think that's helpful for us and our families. So with that being said, I just want to thank you for the time today, and I thank you again for the Navajo people and all the great work that's been done, just with the leadership piece and with the public reaching out and getting their vaccinations. It's been just a tremendous experience. I know that we've had many losses, and as well as I've had losses in my family, and certainly still think about all of our folks who have lost loved ones. But for the great work that's been done, I just want to say thank you across Navajo land. So with that being said, I'm going to turn the time now over to Del Yazzie. Thank you.
All right, thanks, Captain Johnson. Hello, everyone. Thank you all for joining us. My name is Del. I'm with the Navajo Epidemiology Center and our COVID Epi team. I'm here to provide an update on our numbers for this time period from June 3rd to the 9th, the 7-day period. But as always, I'd like to acknowledge our COVID epidemiology team here We are a large team working on COVID across the nation. We have folks from our Navajo Epicenter, IHS, the 638 facilities, and CDC Foundation, from Hopkins and COPE, and also TGen, who's helping us with the COVID strain surveillance, the sequencing work out of their Flagstaff campus. And then last but not least, the state departments of health from Arizona, New Mexico, and Utah. So these are the entities and folks representing these entities are all a part of our COVID epidemiology and disease surveillance for Navajo Nation. This is our latest recent cases and trends graph here. It's as you can see, the blue bars are the daily cases over time from April 11th through June 9th, which is as of last Thursday. It's a 60-day time period. As you can see, the blue bars do fluctuate quite a bit every day. But the orange line is the 9-day weighted center moving average. As you can see, it has increased, has gone up over the 60-day time window here to now we're at about 80 cases on average, a 9-day weighted center moving average at about 80 cases a day. So we certainly have seen an increase in cases over the 60-day time window here. And then which, reflects our 7-day infection rate. It continues to increase and it's now at 1.29. We like to be below 1, so we continue to be above 1. So this is our case incidence across Navajo Nation. 508 new cases over a 7-day period from June 3rd to the 9th, which puts our 7-day case rate at 320 cases per 100,000 people. Some additional metrics here. The lab-based test capacity is now, the 7-day test positivity rate has increased to 22%. Last week was 17%, so it did go up 5 percentage points. And then testing, average daily tests over a 7-day period, 752 tests every day were conducted. So this is a lot of testing still going on across the nation. And then the core metric here is the hospital capacity as far as hospital beds and ICU beds. For a regular inpatient hospital beds as an average daily occupancy. And then the high ICU beds, intensive care unit beds, is at 60% average daily occupancy. And as Captain Johnson mentioned, these hospital capacity percentage numbers are remaining stable, which is a good sign, meaning that people are, even though we're seeing increase in COVID cases, people are not being hospitalized as much. So it's a good sign. This is Navajo Nation residents only for the vaccination rates. Primary series completed at 126,228 people. And then residents that are up to date at 85,180. And 45% of the Navajo Nation residents have completed the primary series and are up to date. And then 67% have completed the primary series. This is just the epi curves for the US in blue. The orange line is Navajo Nation. As you can see on the far right over here, the orange line is Navajo Nation, and we are continuing on this upward trend. Back in, early April, I believe we're at about 6 cases on average a day, to now we're at about 80 cases per day. So the increase. And then the blue line here is the US, which is currently at about the axis for the blue line is on the left side here. So across the United States currently, they're seeing about 110,000 cases per day. Back in late March, early April, there were about, I believe, 25,000. So now it's at 110 or so thousand cases a day across the United States. This is the 7-day incident bar chart comparing Navajo Nation and the 50 states. And we've jumped Navajo Nation to number 4 here because we've had a big jump in increase in cases. And it's reflected here. Number 4 position compared to the 50 states. And then the red bars are the bordering states. New Mexico here, Colorado, Arizona, and Utah. So there are a lot of COVID cases, especially on the New Mexico side of the nation, as well as Colorado. So there are COVID cases, still a high burden within our region. And it's reflected here, 7-day case rates across the country by states, just within our region, Colorado and New Mexico. The darker blue with the higher 7-day case rates, higher burden of COVID cases currently. Community transmission, really all the counties that are within Navajo Nation are all red, meaning there's high COVID transmission. This is the COVID strain surveillance. Comparing report 57 to report 58. I believe we're going to update this, I think today, later today. Report 59 will be coming out, but this table we shared last week remains the same. Just that the only couple highlights here. One is the Delta variant has been downgraded to a variant being monitored. So they're now down here with this, and the sublineages went from 1744 to 1745, just one new case. The BA2 Omicron sublineages went from 45 to 88, was last 43 new cases identified with the BA2. And here, the CDC variant profile across the country. Just a couple highlights here is the BA4 and 5 here continue to increase in cases across the US. And they've been in the news lately as potential variants that can evade the vaccine, and also might become or might be resistant to the vaccine, and that's what the experts are saying. This BA2.12.1 is still the predominant variant, but it's decreasing each week. When we'll continue to monitor the BA4 and BA5 as we move forward. And the BA4 and BA5 have not been detected on the Navajo Nation. So the monitoring will continue. These are the high-risk chapters. There are 40 new chapters identified as a high-risk chapter this time around. And then these chapters here, 27 chapters, have been on the list for 3 weeks. And then these 16 chapters for about a month. And then 5 weeks or so, these 7 chapters. And Chinle and Ganado chapters have been on here for at least 6 weeks. And last, there's a big jump in our number of cases this time around. So there's a plus 48% change from last week. Our 7-day case rate has increased to 320 cases per 100,000. So high COVID risk and transmission across our Navajo Nation. The BA2 and the BA2.12.1 have been detected on the nation. We'll continue to monitor the BA4 and BA5 going forward in partnership with TGen. So, and then our test positivity has increased to 22%. And the good news is the hospital bed capacity or occupancy has remained stable. So hospital beds at 64% and ICU bed at 60%. So that's one good news for our latest number. So I'm going to stop here, and I believe I am the last presenter. So we're going to end here, and I just want to thank you all for joining us. Thank you.